Welcome to WorkCover Western Australia. This short video will assist you with getting back to work after a workplace injury. We'll explain the return to work process and what help is available to you. If you haven't yet lodged a claim, watch our Making a Claim video as it outlines the steps and what's involved. Working is good for our health and well-being. When you've been injured at work, an early and successful return to work will help you get back to normal life. You are the most important person to manage your injury and recovery. Focus on what you can do, rather than what you can't. Speak with your doctor about the kind of work and activities that can assist your recovery. Keep your employer informed and stay in touch with your workmates. Be involved in planning your return to work. Other people involved in your return to work include your employer, your treating doctor, and the case manager the insurer has allocated to your claim. Most of your return to work activities will be based on the medical certificates your doctor issues, called certificates of capacity. You may not be 100% recovered, but working together with your doctor, employer, and the insurer will ensure you get the help you need to return to work. Once your doctor issues a certificate of capacity that shows you can do some work, you and your employer can start to plan this process. If you can't return to your usual work, your work activities need to be recorded in a return to work program. The return to work program sets out how, when, where, and in what way you will return to work. The program will be prepared by your employer, sometimes with help from the insurer, and reflects the certificate of capacity from your doctor. Sometimes a workplace rehabilitation provider will also help to get you back to work. You need to discuss with your employer and doctor your usual job, what alternative tasks you can perform, your working hours, and what supervision or other support you may need. It's important that your return to work goal is identified early so everyone can work towards it. In most cases, you'll return to your usual job. However, an injury may keep you away from your pre-injury position for weeks or even months, or you may not be able to return to your usual job at all. If this is the case, your employer may be able to provide you an alternate job permanently, or the insurer can assist you with finding a new job with a new employer. The workplace rehabilitation provider can also help if you and your employer have trouble finding suitable duties. You need to do a work trial or retraining, or there are other issues stopping your return to work. Although you can choose your workplace rehabilitation provider, the insurer will usually coordinate the referral on recommendation from your doctor. Case conferences can also be held to bring together everyone involved in your claim. If a return to work program is in place, you're expected to attend work and perform the agreed duties set out in it. Otherwise, your compensation entitlements may be affected. If you're having difficulties following the program, speak with your doctor, the workplace rehabilitation provider, your employer, or insurer so amendments can be made to it if necessary. You're not alone in this process. Further information and help are available. Speak with your case manager and ask them to explain what assistance the insurer can provide. If you have any questions about returning to work and your duties, contact your employer, doctor, or workplace rehabilitation provider. You can also speak with one of our advisory officers by calling 1300 794 744. Publications and forms can be accessed on our website.